Before performing any task, the CNA must first A. Put on gloves. B. Identify the resident and explain the procedure. C. Gather all supplies quietly. D. Ask another aide for help. Answer: B. Residents have the right to understand the care being given. Identification and explanation ensure safety and consent. When helping a resident stand using a gait belt, the CNA should A. Place the belt loosely around the waist. B. Hold the belt from the back with an underhand grip. C. Pull the belt upward suddenly. D. Wrap the belt under the resident's arms. Answer: B. An underhand grip provides secure support and prevents injury during the transfer. If a resident begins to fall, the CNA should A. Catch the resident quickly and lift them up. B. Use body mechanics to ease the resident to the floor. C. Shout for help and step back. D. Run for a nurse immediately. Answer: B. Easing the fall prevents injury to both the resident and the CNA while maintaining control. A resident who is NPO should A. Receive no food or fluids by mouth. B. Receive liquids only. C. Be given ice chips. D. Have extra snacks offered. Answer: A. NPO means nothing by mouth. Feeding or giving liquids can cause aspiration. The CNA notices the resident's right arm is swollen around the foresight. The best action is to A. Remove the fore. B. Elevate the arm and apply ice. C. Report it to the nurse immediately. D. Ignore since swelling is normal. Answer: C. Swelling may indicate infiltration or infection, and only the nurse may assess or remove IVs. During morning care, a resident tells the CNA they feel dizzy. The aide should A. Have the resident sit or lie down and call the nurse. B. Help the resident walk around. C. Ignore and continue the bath. D. Leave the resident alone to rest. Answer: A. Dizziness may indicate low blood pressure or hypoglycemia. The nurse should be notified. When collecting a urine specimen, the CNA should A. Touch the inside of the container for accuracy. B. Label the specimen before collecting it. C. Use a clean container and label after collection. D. Leave it uncovered at the nurse's station. Answer: C. Labeling after collection ensures correct identification while preventing contamination. A resident suddenly becomes unresponsive. The CNA's first action is to A. Call the nurse and check for breathing and pulse. B. Start CPR immediately. C. Leave the room for help. D. Cover the resident with a blanket. Answer: A. Check for responsiveness and breathing first, then call for help per facility emergency protocol. The most effective way to reduce the spread of C. difficile is to A. Use alcohol-based sanitizer only. B. Wash hands thoroughly with soap and water. C. Wear 2 pairs of gloves. D. Spray air disinfectant. Answer: B. Difficile spores are not killed by sanitizer. Soap and water are necessary for removal. When feeding a resident who has one-sided weakness, the CNA should A. Feed from the weak side. B. Feed from the strong side of the mouth. C. Alternate between sides. D. Stand behind the resident. Answer: B. Feeding from the strong side prevents choking and helps the resident swallow more safely. Proper handwashing requires A. Rinsing before applying soap. B. Washing for at least 20 seconds with friction. C. Drying hands with personal towel. D. Keeping hands below elbows during rinsing. Answer: B. Friction for at least 20 seconds removes germs effectively. Hands are rinsed with fingers downward. When measuring blood pressure, the CNA should A. Inflate the cuff until the resident feels discomfort. B. Ensure the cuff is snug and placed on bare skin. C. Place the cuff over clothing. D. Record an estimate if unsure. Answer: B. The cuff should be applied directly to the arm for an accurate reading. A resident complains of shortness of breath while walking. The CNA should A. Help the resident sit and notify the nurse. B. Encourage deep breathing and continue walking. C. Offer water. D. Ask another aide to finish. Answer A. Stopping activity and notifying the nurse ensures safety and prompt medical attention. When cleaning a resident's glasses, the CNA should A. Use tissue paper and alcohol. B. Rinse with warm water and dry with a soft cloth. C. Use soap and rough towel. D. Spray disinfectant directly. Answer B. Gentle cleaning prevents scratches and maintains the resident's vision aid properly. Which of the following promotes effective communication with residents? A. Talking rapidly to save time. B. Maintaining eye contact and listening actively. C. Standing far away during conversation. D. Interrupting often to clarify. Answer B. Active listening and eye contact show respect and improve understanding. When assisting a resident with a weak right arm to dress, the CNA should A. Dress the strong side first. B. Dress the weak side first. C. Ask the nurse to do it. D. Dress both arms at once. Answer B. Dressing the weak side first reduces pain and makes dressing easier. The CNA finds a resident's bed soaked in urine. The correct first step is to A. Scold the resident. B. Change the linens and provide perineal care. C. Report the incident after the next shift. D. Ignore it. Answer B. Maintaining cleanliness and dignity is crucial. Report afterward as needed. A resident is upset after receiving bad news. The CNA should A. Offer comfort and listen empathetically. B. Change the topic immediately. C. Leave the resident alone for hours. D. Tell them to stop crying. Answer A. Emotional support is part of compassionate care and helps residents cope with distress. When lifting an object, the CNA should A. Bend at the knees and keep the back straight. B. Bend at the waist only. C. Keep feet close together. D. Hold object far from body. Answer A. Proper body mechanics prevent back injuries and provide stability. A resident on oxygen therapy requests lotion for their face. The CNA should A. Apply oil-based lotion. B. Apply alcohol-based lotion. C. Use only water-based lotion. D. Decline and leave it dry. Answer C. Oil-based products are flammable, only water-based lotions are safe near oxygen. When should the CNA report a resident's low urine output? A. Only if the resident complains. B. At the end of the week. C. Immediately to the nurse. D. After charting for others. Answer C. Low urine output may indicate dehydration or kidney problems and needs prompt reporting. A resident refuses to take a shower. The CNA should A. Force them to bathe. B. Respect their choice and report to the nurse. C. Threaten to tell the family. D. Ignore and leave. Answer B. Residents have the right to refuse care. The nurse must be informed for documentation. A CNA must wear gloves when A. Feeding a resident. B. Taking temperature orally. C. Performing perineal care. D. Reading a chart. Answer C. Gloves are required whenever contact with body fluids is possible. The CNA observes a small red area on a resident's lower back. The aide should A. Massage it to improve circulation. B. Report it to the nurse immediately. C. Apply powder. D. Ignore it. Answer B. Redness may be an early sign of a pressure injury and must be reported promptly. To prevent aspiration during feeding, the CNA should A. Feed quickly while the resident talks. B. Keep the resident upright during and after the meal. C. Feed while lying flat. D. Offer large bites. Answer, B. Sitting upright prevents food from entering the airway and causing choking. Which item is considered personal protective equipment, PPE? A. Gait belt. B. Gloves. C. Blanket. D. Call light. Answer, B. PPE includes gloves, gowns, masks, and goggles to prevent infection transmission. A resident with dementia tries to remove their clothing. The CNA should A. Restrain them immediately. B. Gently redirect to another activity. C. Yell to stop them. D. Report only at the end of shift. Answer, B. Redirection is an effective technique to manage dementia-related behaviors calmly. The CNA is assigned to care for a new resident. The best way to build trust is to A. Talk about personal life. B. Be consistent, respectful, and honest. C. Use humor frequently. D. Avoid eye contact. Answer, B. Professional consistency and respect create trust between residents and caregivers. The CNA should report to the nurse if a resident's pulse is A. 72 beats per minute. B. 60 beats per minute. C. 45 beats per minute. D. 80 beats per minute. Answer, C. A pulse below 60 may indicate bradycardia and must be reported. Before weighing a resident using a standing scale, the CNA should A. Ask the resident to keep shoes on. B. Balance the scale at 0. C. Hold the resident during measurement. D. Ignore if unsteady. Answer, B. Balancing the scale ensures accurate measurement.